Has someone you deeply care about begun to exhibit subtle yet concerning changes over the past year? Many assume that the end of life in old age occurs suddenly, but the reality is that the body often sends quiet signals, months or even a year, before reaching its final stage. The challenge lies in the fact that these signs are often overlooked because they appear minor at first. It's only in hindsight that families realize the clues were present all along. By then, however, it's often too late to prepare or to create meaningful final memories. In this video, we will explore 5 key signs that frequently emerge about a year before an elderly individual passes away. Some of these signs may be things you've noticed but dismissed as part of the natural aging process. Others might seem insignificant, but are actually indicators of the body's gradual decline. Recognizing these signs early can empower you to provide better care, cherish precious moments, and, most importantly, ensure that your loved one's final stage of life is marked by comfort, dignity, and peace. Stay with us until the end, as understanding these 5 signs can help you prepare, both emotionally and practically, for what lies ahead. When you are aware of what's happening, you won't be caught off guard. Instead, you'll be able to make the most of the time you have left with your loved one. Let's begin. Number 1. Significant weight loss. One of the earliest and most telling indicators that a person may be entering the final year of their life is unintentional weight loss. Initially, it may seem subtle: a belt that needs tightening, clothing that fits more loosely, or a once robust appetite that begins to wane. Many families attribute this to the natural aging process, but the truth is that unexplained weight loss is rarely a benign sign. It often suggests that the body is no longer absorbing nutrients efficiently, muscle mass is diminishing, and vital systems are slowing down. While some degree of muscle loss is expected with age, rapid or significant weight loss is a red flag. It may indicate that the body is struggling to digest food properly or is no longer able to process protein effectively, leading to muscle wasting. This loss of strength not only makes movement more challenging, but also increases the risk of falls, weakens the immune system, and leaves the individual more susceptible to infections. Another contributing factor to weight loss in the final year of life is a decline in appetite. Many elderly individuals experience a reduced sense of hunger. Their taste buds may dull, making food less enjoyable, and they might begin skipping meals or eating smaller portions. This isn't merely a matter of preference, it's a physiological shift. As the body begins to prepare for its final transition, it no longer sends the same signals to the brain to seek food. The result is a decline in energy, strength, and overall health. Underlying medical conditions can also play a significant role. Weight loss is a common symptom of chronic illnesses such as cancer, heart failure, or kidney disease, all of which can progress silently before more obvious symptoms arise. Even conditions like depression or cognitive decline can lead to reduced food intake, creating a cycle where the body lacks the necessary fuel to sustain itself. Families often respond by encouraging their loved ones to eat more, offering favorite foods, or supplementing meals with protein shakes. However, if weight loss persists despite these efforts, it's crucial to recognize that the issue extends beyond diet. It's a sign that the body is undergoing a deeper transition. At this stage, forcing large meals may not be beneficial. Instead, focusing on comfort, easily digestible foods, and proper hydration can help maintain quality of life. If you observe significant weight loss in an elderly loved one, particularly if accompanied by reduced appetite, weakness, or decreased activity, it's time to take notice. This could be a critical moment to provide the care and attention they need during this delicate phase of life. This is not merely about physical appearance. It's about the body sending a profound message, one that, if understood in time, can help you navigate the road ahead with clarity, compassion, and the ability to make every remaining moment truly meaningful. Number 2. Extreme fatigue and weakness. One of the most striking changes in the year leading up to the end of life is a deep, unrelenting fatigue that persists despite rest. This isn't the kind of tiredness that follows a long day. It's an overwhelming exhaustion that makes even the simplest tasks feel like monumental challenges. Rising from bed becomes a struggle. Walking across a room requires immense effort, and activities that were once routine, such as cooking, dressing, or even holding a conversation, begin to feel unbearably draining. This fatigue is not simply a byproduct of aging. It's a signal that the body is conserving its dwindling energy reserves. As organ function begins to slow, the body prioritizes essential processes. The heart pumps less efficiently, circulation weakens, and muscles receive less oxygen than they once did. This is why many elderly individuals in their final months often feel weak, unsteady, and unable to maintain the level of activity they once enjoyed. Another contributing factor is a metabolic slowdown. The body, designed to produce and utilize energy, begins to redirect its resources as it prepares for its final phase. Instead of fueling movement, the body shifts its focus to preservation. This is why someone in decline may sleep more, require frequent naps, and find it increasingly difficult to stay awake for extended periods. Some may even experience sudden energy crashes, appearing fine one moment and utterly drained the next. Perhaps the most poignant aspect of this process is its emotional toll. Many seniors who once took pride in their independence begin to feel frustrated or even ashamed that they can no longer perform tasks they once managed with ease. They may withdraw from conversations, avoid social interactions, or abandon hobbies, not out of disinterest, but because they simply lack the energy to engage. This can lead to a cycle of isolation, where they stop trying altogether, accelerating their decline. For families, witnessing a loved one transition from being active and engaged to exhausted and withdrawn can be deeply painful. It's easy to misinterpret their fatigue as laziness or to encourage them to push through it. However, forcing activity is rarely helpful. What matters most is understanding their limitations, allowing them to rest when needed, and ensuring their remaining days are as comfortable and peaceful as possible. If you notice a loved one experiencing profound, unrelenting fatigue that isn't alleviated by rest, recognize it as a sign that their body is undergoing a significant transition. This is a time to cherish quiet conversations, create moments of serenity, and offer support without expectations. Ultimately, what matters most isn't how much they can do. It's that they feel loved, understood, and at ease. If you're finding these insights valuable, please comment number 2 below to let us know you're here. And if you haven't subscribed yet, we encourage you to do so and turn on the notification bell to stay updated. Your support enables us to continue creating meaningful content that informs and inspires. Now, let's move forward. Number 3. Increased cognitive confusion or withdrawal. As a person approaches the final stage of life, one of the most noticeable changes often occurs in their cognitive function, communication, and social interactions. You may observe that someone who was once sharp and engaged begins to forget things more frequently, struggles to follow conversations, or becomes disoriented in familiar settings. They may repeat themselves, forget names, or lose track of time, even if they've never experienced memory issues before. These subtle cognitive shifts can emerge months or even a full year before death. This is not ordinary forgetfulness. The brain, like other organs, relies on a steady supply of oxygen and nutrients to function optimally. As circulation weakens and oxygen delivery to the brain diminishes, cognitive abilities begin to decline. The person may become easily confused, have difficulty making decisions, or struggle to recognize people or places they've known for years. In some cases, they may experience fleeting moments of clarity followed by sudden confusion, almost as if their mind is flickering in and out. Another common sign is emotional withdrawal. Individuals nearing the end of life often lose interest in social interactions. You might notice them speaking less, engaging less, or spending long periods in silence. This isn't a reflection of their feelings toward loved ones. Rather, their brain no longer processes emotions and engagement in the same way. Conversations become exhausting, noisy environments feel overwhelming, and many seniors gradually retreat into their own world. Changes in mood and behavior may also become apparent. Some individuals grow more irritable, anxious, or easily frustrated. Others may seem unusually calm, detached, or indifferent to things that once held great importance. This isn't merely a shift in personality. It's often a result of the brain adapting to the body's decline. As cognitive function slows, emotions become harder to express, and the person may no longer react to situations as they once did. For family members, these changes can be deeply challenging to witness. It's essential to approach your loved one with patience and compassion. Instead of trying to fix their confusion or withdrawal, focus on creating a calm and supportive environment. Speak gently, offer reassurance, and treasure moments of connection, no matter how brief they may be. Recognizing these signs early can empower you to provide the care and understanding your loved one needs during this delicate stage of life. Stay with us as we continue to explore the remaining signs that often appear in the final year of life. This stage can be particularly challenging. Watching a loved one lose touch with reality or withdraw emotionally can feel like losing them before they're truly gone. However, it's crucial to remember that this is not something they can control. Rather than trying to bring them back into conversations or activities, the best approach is to meet them where they are. Speak gently, offer reassurance, and understand that even if they don't always respond, they can still feel your presence and love. If you notice a loved one becoming more forgetful, confused, or less engaged, don't dismiss these changes. They are often early indicators that the body and mind are preparing for the final transition. This is a time to practice patience, cherish quiet moments, and focus on creating an environment that feels safe, familiar, and peaceful. Even when words fade, the warmth of love and comfort can still be deeply felt. Number 4. Frequent infections and slow healing as the body begins to wind down. One of the most evident physical signs is a weakened immune system. You may notice that someone who rarely fell ill before now seems to catch every cold, flu, or minor infection that comes their way. What were once minor illnesses now take much longer to recover from, and simple wounds, like a small cut or bruise, heal at a noticeably slower pace. These changes are not random. They are clear signs that the body is no longer able to defend or repair itself as effectively as it once did. One of the most significant concerns is the recurrence of infections. Pneumonia, urinary tract infections, UTIs, skin infections, and even oral infections become more common as the immune system weakens. Many families assume these are isolated incidents, but when they occur frequently or take longer to resolve, it's often a sign that the body is losing its ability to fight back. Even antibiotics, which once worked quickly, may seem less effective. The person may require stronger medications, extended recovery periods, or multiple rounds of treatment for infections that would have previously been minor. This decline occurs because, as circulation slows and organ function diminishes, the body's ability to respond to treatment weakens. Another often overlooked issue is chronic wounds. If you notice that small scratches, sores, or bruises aren't healing properly or keep reopening, it could indicate compromised circulation. Poor blood flow means that oxygen and nutrients aren't reaching the skin and tissues efficiently, significantly slowing the healing process. Pressure sores, particularly for those who are less mobile, become a serious risk and can lead to dangerous infections if not carefully managed. What's even more concerning is that infections in the final year of life often present differently than expected. Instead of a high fever, an elderly person may simply appear more fatigued, confused, or less interested in eating. In fact, for seniors, a sudden decline in mental alertness is often the first warning sign of an infection, even before other symptoms appear. This is why recognizing these changes early can make a profound difference in the comfort and support they receive during this delicate stage of life. For families, witnessing a loved one endure repeated infections can be both frustrating and heartbreaking. It's natural to want to pursue aggressive treatments, hoping that one more round of antibiotics or another hospital stay will resolve the issue. However, at a certain point, the focus often shifts from curing to comforting, ensuring they stay hydrated. Keeping their skin clean and moisturized, and minimizing stress on the body can do more for their well-being than another round of medication that may only prolong suffering. If you're finding these insights valuable, please comment number 4 below to let us know you're here. And if you haven't subscribed yet, we encourage you to do so and turn on the notification bell to stay updated. Your support enables us to continue creating meaningful content that informs and inspires. Now, let's move forward. Number 5. Major changes in breathing or circulation. One of the most telling signs that the body is preparing for its final stage is a noticeable change in breathing patterns and circulation. You may observe that your loved one breathes more slowly or shallowly than before. At times, they might pause between breaths, or their breathing may become irregular, speeding up and then slowing down unexpectedly. Some individuals experience a gentle, rhythmic breathing pattern called Cheney-Stokes respiration, characterized by alternating deep, rapid breaths and long pauses. These changes may start subtly but often become more pronounced and frequent over time. Another common sign is weakened circulation. You may notice that their hands, feet, or even their nose and ears feel cold to the touch. The skin may appear pale, bluish, or mottled, particularly around the fingers and toes. This occurs because the body prioritizes blood flow to vital organs, reducing circulation to the extremities. It's a clear indication that the heart is no longer pumping as strongly as it once did. Some individuals also experience increased shortness of breath, even with minimal movement. Simply sitting up, speaking, or shifting positions might leave them feeling winded or out of breath. You may notice them breathing through their mouth more often, or they may need to pause frequently to catch their breath while talking. If they were once able to walk across the room with ease but now struggle to do so, it may signal a decline in lung function. In some cases, fluid buildup in the lungs can make breathing more difficult. This can lead to a persistent cough, gurgling sounds, or a feeling of tightness in the chest. While many assume this is simply congestion from a cold, in elderly individuals nearing the end of life, it's often a sign that the lungs are weakening. This can make lying flat uncomfortable, and they may prefer to sleep propped up on pillows or in a recliner to ease their breathing. For family members, witnessing these changes can be deeply unsettling. It's natural to want to help, to encourage deeper breaths, or worry that something urgent is happening. However, in many cases, this is simply the body's natural way of slowing down. While there may not always be a way to reverse these changes, there are ways to make them more comfortable. Keeping the room cool, using a humidifier, or offering small sips of water can help ease discomfort. In some cases, medications or oxygen therapy may provide relief, but the focus often shifts toward comfort rather than attempting to fix the issue. If you notice these signs, changes in breathing, cold hands and feet, or a bluish tint to the skin, pay attention. These are often indicators that the body is conserving energy and that circulation is slowing down. It's a time to be present, offer reassurance, and create a peaceful environment where they feel safe and at ease. In these final months or weeks, the most important thing you can give them isn't medical intervention. It's comfort, dignity, and the knowledge that they are not alone. As we conclude this video, take a moment to reflect on what we've discussed. Significant weight loss, extreme fatigue, cognitive decline, frequent infections, and major changes in breathing and circulation. These 5 signs often appear in the year leading up to an elderly person's passing. They may not all occur at once, and they may not always be obvious at first, but when you begin to notice them, it's a sign that the body is preparing for its final transition. For many families, these changes can be difficult to accept. It's natural to want to fight against them, to encourage a loved one to eat more, move more, or push through exhaustion. However, sometimes the most compassionate thing we can do is listen to what their body is telling us. Instead of focusing on reversing the inevitable, we can focus on making their remaining time as peaceful, comfortable, and meaningful as possible. Understanding. These signs isn't about fearing death. It's about being prepared for it. When you recognize these changes early, you can provide better care, make important decisions ahead of time, and ensure that your loved one's final months are filled with love and dignity. This is a time for cherishing moments, sharing stories, and letting them know they are valued and not alone. Thank you for joining us today. If you enjoyed this video and found it helpful, please like, subscribe, and share. Also, if you enjoy this content, comment yes below. If you don't, comment no, so I can improve future videos for you. Thanks for watching, and we look forward to seeing you.